Welcome to Inclusion Matters, a podcast about children's development from the Center for Inclusive Childcare. Welcome to Inclusion Matters, a podcast from the Center for Inclusive Childcare. I'm Priscilla Weigel, and I'm here with a friend and colleague, Michelle Fallon, who is infant and early childhood mental health consultant with a real passion for childcare, and she has spent many years working in the field, and she's just has such great expertise and also a lot of compassion, and we're really grateful that she's taking some time out to do some podcasting with us. So Michelle, welcome.
Thank you for that nice introduction.
It's my pleasure. Well, you deserve it. So today we're going to talk about something that I think is part of the job of a child care provider, a professional in the field. However, it's something that maybe isn't touched on a lot because we're working on caring for the kids. And Michelle is here to really help us understand ways to facilitate some of that great parent-child bonding and connectedness in a family setting that we might not think is really our role, but part of our role is to support a whole healthy child, and family is part of that. Would you agree?
I would totally agree. And I think that's a really, we don't talk about that enough. I think, talk about improving the quality of childcare, and it's so often about providing children with learning skills and pre-kindergarten kinds of things. And we're really missing the opportunity to promote healthy parent-child relationships.
Yeah.
And research tells us that that is the most reliable predictor of children's school and social emotional success is the quality of the relationship they have with their parent.
Wow.
So when you think about it, a caregiver and parent are really co-parenting a child.
Yeah.
And so how do we think about that? What are we doing to enhance that co-parenting relationship between the caregiver and the parent? Because the quality of that relationship also impacts the child.
Sure. Yeah. And how they are in our care then as a caregiver in the child care setting. So here's my big question. That can be really tricky.
Oh,
because it's seen often as two very separate worlds, I think. So what are some suggestions for helping folks to even just begin the process of thinking about that? And I mean, what would you say would be a great place to start that might foster some of those really essential connections?
Well, I think first of all, to as providers, for us to keep in mind how powerful the messages are that we give to parents. I think every parent is asking, what kind of a child do you think I have?
Yeah.
And what kind of a parent do you think I am? And rarely would that be said out loud, but I guarantee you every parent is wondering.
Yes.
And so to think about how we are messaging parents, no matter how the day went, is there one cute thing or one positive thing I can tell a parent about her child when she picks up? So there's that. But then I think also to try to be intentional about cultivating our relationships with parents. So just, you look tired today. How was the night? How's work going? Or, I hear you had a big test. How did that go? Whatever it is, we're not digging to China. We're not trying to be friends necessarily, but we are expressing interest in parents because we think about that as parallel process. If the parent has the experience of this provider holds me in mind as well as my child in mind, how much more likely am I going to be to think about my child in positive ways?
Sure. And sometimes in situations, especially those with challenging behaviors involved or those sleepless nights that are due to perhaps a special need or a diagnosis, parents are really looking for some guidance and support and someone that's really going to notice that they're doing a great job too, because I think not that we have to just say great job or just anything that we notice that they're doing well or that's enhancing their child's life. And it might even be that new pair of shoes that they got that their child was so eager to show off today.
Yeah.
How you figured that out, that he loved those light up shoes, or that new backpack really seemed to really give him extra skip in his step today, or what do you put in his lunch? Some of those things can be so easily forgotten because we're in the midst of our day. But if we really take the time to think about them and point them out, it's just a little pat on the back. And you know, as parents, you don't get a lot of pats on the back.
No, you don't.
You don't. You really need that.
Absolutely. And I think, you know, I like to think that any of us who works with parents and young children, that we really think about the fact that we're involved with three clients, so to speak. First, of course, the child. The child is our focus. But also the parent and how the parent is doing, because that will impact the child so directly. But then the third client is the quality of the relationship between the parent and the child, and how am I attending to that? What have I done today to promote that parent-child relationship? And sometimes, you know, as you're saying, it's not there. Sometimes it's hard to find a positive.
Yeah.
So finding that, but then just taking the parent's perspective. I wonder what it's like to have a long day at work and then come pick up your child and have to hear that your child bit somebody today again. So how can I deliver that message, which I have to deliver, but in a way that is trying to imagine what it's like to be the parent listening to that.
Right. Yeah. And that sharing of that information is going to impact the rest of their day, the rest of their evening, the ride home in the car, when they should be connecting with their child and asking about how the day went in other facets too. They're focusing then on that really hard thing that the child knows was hard. But now the parent gets that little package of hard to take home with them too, and it's a lot.
It is a lot.
Yeah.
I think there are some challenges, of course, that go with that. Parents have protective urges. I mean, they're handing over the most precious thing that they have, which is their child.
Yeah.
And on the other hand, as providers, we may feel very strongly about what happens to that child when they're not with us as well.
Yes.
I mean, I think about the provider who had to see that this young parent brought her child in on a Monday morning with a pretty significant diaper rash, and how angry the provider was with the parent for letting that happen.
Right.
But come to find out, the parent had been asked to leave her grandmother's home with 2 diapers in her purse to last the weekend. You know, so it's that may be extreme, but I think again, the protective urges are part of our biology.
Right.
I mean, we're wired to be protective of young children, and sometimes that creates challenges in the relationships between these co-parents, namely the provider and the parent.
Yeah.
So being aware of those, we don't have to necessarily react out of them, but try to be intentional about how we respond to those often big feelings.
And sometimes it is just a matter of thinking about it. And, you know, it's saying to yourself, I wonder if there could be some more information that I don't have here in this situation before I jump to this assumption that, you know, she wasn't caring for her child all weekend. What else could be going on? And that maybe is the first step for you, just as a child care provider every day, to just catch yourself in how quickly am I jumping to those assumptions, or and you're not maybe spending a ton of time cultivating that relationship between the parent and the child, because you've got to start somewhere. You've got to start right at the very basis of checking your thinking and how you see it and view it, and that lens of, you know, your day to day. And we just had this conversation with our team recently, just making those assumptions and speaking negatively about parents instead of seeing it as that co-parenting partnership, which I think just the fact that you've brought that up, Michelle, in this conversation has been very helpful for folks. And I hope that they find that that's the first step in being aware that there's 3 parts to this. And your role as a child care provider is really to support that very critical relationship with parent and child. And that's a tricky path. And we look forward to having you back again to delve into it a little more deeply and maybe give some more tips on ways to plan more in advance. If you look at your center-based care or family child care, how that looks in the types of settings that are out there in the world and caring for kids. So thank you, Michelle.
My pleasure, Priscilla.
Great to be with you.
Thanks for listening. For more resources, Visit us at inclusivechildcare.org.